Hello people, welcome to my channel Physio Guide by Divya. Today I am going to teach about cerebral palsy topic detailed completely. So cerebral palsy and notes also I have given in the description box. Once check it out. Okay, first of all listen this video, you will get a brief idea on it. Cerebral palsy, what is it? See the definition. It's a disorder of movement and posture. Okay, it is caused by non-progressive injury. Non-progressive means permanent, unchangeable injury to the immature brain. Immature means not fully developed brain. By this immature brain, there will be movement and postural imbalance. Okay, as a result, there is a change in the muscle tone, posture, both at rest and in voluntary activity also. While doing activity also, there will be abnormalities. Okay, now etiology. What are the when this cerebral palsy occurs means prenatal factors. Due to prenatal means before birth, baby before birth factors. Perinatal means before weeks, some weeks, and after birth some weeks. That period is perinatal period. Now postnatal means after birth. Now prenatal factors. What are this prenatal? Due to hereditary and genetic factors and prenatal infections also, that due to viral infections, bacteria, and due to any parasitic infections. Okay, now due to fetal in stomach, fetal anoxia means anoxia means due to absence of oxygen supply by hemorrhage means due to blood rupture, the oxygen will be diminished, absence of oxygen is seen. So fetal anoxia and premature separation of the placenta means that due to that maldevelopment of placenta at the time of prenatal, we'll see this cerebral palsy also may occur. Due to RH factors like erythroblastocytosis and hemolytic anemia, hyperbilirubin. Okay, these are also the causes before birth. Next, metabolic disorders such as maternal, if any mother diabetic, okay, there is a chance of abnormality in baby, in fetus, and developmental defect which may include maldevelopment of brain and vascular and skeletal means bone structures. Okay, due to those maldevelopment also this CB is seen. Okay, now due to perinatal, what are the perinatal factors? Means the number of weeks before and after birth. What are at that time, what is the damage, if there is any damage, what are the causes? Means due to rupture of the brain blood vessels. Okay, blood vessels and compression of the brain during prolonged or difficulty in labor. Okay, during that time there is a compression of the brain, so this also is seen. And premature separation of the placenta. Next, postnatal means after birth. What are the causes? Means why this cerebral palsy occurs means due to any vascular accidents and intracranial hemorrhages means rupture of the blood inside the brain, intracranial, and head injury and brain infections, including those are bacteria, virus, and encephalopathy. Next, toxic conditions such as lead poisoning, any poisoning. Okay, and anoxia. Now types of cerebral palsy, those are spastic means that stiff muscle spasm, stiffness. Okay, next, ataxia. Ataxic means this is due to impaired balance and coordination. Impaired balance and coordination is seen. Okay, now dyskinetic means due to any shakes or tremors are seen. Dyskinetic only, there are dystonic and choreoathetosis. Dystonic, due to in this there are two types, hypokinesia and hypertonic. Hyperkinesia means slow muscle movement and hyper means due to overactivity. Next, choreoathetosis. In this there are also two types opposite to that. What are means hyperkinesia and hypotonic, in this opposite to that. Okay, excess and low. Next, mixed means these two combination. Okay. Now cerebral palsy associated disabilities. Along with the cerebral palsy, what are the disabilities seen? Means mental retardation, epilepsy, speech disorder, vision and hearing imbalance, and behavioral abnormality, learning abnormalities are seen along with that. Now what are the problems seen? Means that firstly feeding problem mainly seen. The baby cannot failure to suck and gaggling and choking and vomitings, regurgitation is seen, dribbling and constipation, crying, screaming, sleep disturbances, growth retardation is seen, and associated features also eyes, ears, speech, sensory defect, seizures, intellectual and miscellaneous also are seen. Next, diagnosis. How to diagnose whether it is CP or not means, the diagnosis of CP should be suspected when the child doesn't have the normal behavior and neurologically is not unfit, and essentially if abnormalities of posture and involuntary movements and neurological defects are present, so we can identify that as CP. Next, prevention. This is by good parental care. Parental care need to be taken before and after pregnancy. Next, early detection in scanning we can see the early detection and prevent the condition complications after. Next, management. What is the management means? This is the systolic treatment is given for seizures and tranquilizers. These are prescribed for behavior disturbances, and muscle relaxants are given for muscle problems. Okay. Next, occupational therapy means this is made for self-help, to self-help themselves in feeding and dressing. First of all, those are more important. No? Next, after that, more activity like typing. Next, we can teach them. Next, educational. This educational, when there is defect in vision and perception, speech, learning are managed by adequate special educational experiences. Okay. Now, orthopedic support. This is by splints need to be suggested to reduce the stiffness in the muscle. Okay. Now, social support need to be given. Social and emotional support need to be given to the child. Next, rehab and vocational guidelines by the parents should help the child to adjust in the society, okay, and if possible to become self-reliant and independent, okay, by proper vocational guidelines. Okay, so I hope you understood this topic. Cerebral palsy, etiology, how it occurs, and types of cerebral palsy, diagnosis, prevention, management. Okay, thank you for watching this video. Notes also is given in the description. Kindly check. Thank you.